So today we are going to talk about primary healthcare and what it means. Before we dig into the subject, I would like you to take some time to think about what is your understanding of primary healthcare. What comes to mind when you think about this particular aspect? Have you experienced primary healthcare in your life? And if you have, what was it like? So, what is primary healthcare? You may have thought about primary healthcare as the provision of basic healthcare services to people. And you're right to a certain extent. Primary healthcare means provision of essential healthcare that is based on scientifically sound and socially acceptable methods and technology. In the previous session, we talked about Alma Ata Declaration and the history behind Alma Ata Declaration and the provision of primary healthcare services. We talked about that how before 1978, the world leaders were concerned about the disparities between populations and the healthcare services provided to them. And therefore, WHO and UNICEF brought people together from 134 countries into Almaty, which was one of the cities in Kazakhstan, where people talked about how can we make sure that the provision of healthcare services is improved and everybody has access to basic healthcare facilities at the place where they live. And that's where the concept of primary healthcare developed. It has since evolved and has got significant influence on the provision of public health and the public health concepts that we have these days. There are certain key elements of primary healthcare, and these include reducing exclusion and social disparities in health, making sure that everybody living in a community, in a country, in a place has access to healthcare services, organizing health services around people's needs and expectations, and in making sure that these are integrated into health into all sectors. Pursuing collaborative methods of policy dialogues with those who are involved in policy development and making sure that the healthcare needs are reflected on those dialogues and the decisions are made to help with the healthcare decision and to make people's life healthier. Increasing stakeholders' participation, which means that involving everybody who is interested in health in a community into the development of the policy, into design and delivery of the services where possible. There are certain elements of primary healthcare, and you might think these are some of the same things that we talked about earlier. So, for instance, first element is educating on health problems and their prevention and control, making sure that people understand healthcare problems and understand how to prevent and control them. Developing effective food supplies and proper nutrition. Again, one of the aims which is there to make sure that people have got the right kind of food to preserve their health and to promote their well-being. Provision of maternal and child health services, including family planning. Provision of adequate and safe water supply and basic sanitation facilities in every country, because a lot of the problems or healthcare problems arise because of the lack of basic sanitation facilities or lack of availability of safe water. Immunization against major infectious diseases, local endemic disease control in any country, and appropriate treatment of common diseases and injuries. And finally, provision of basic and essential medication where needed. Let's look at the principle of primary healthcare. So again, we did talk about the reducing disparities, and again here it is about accessibility and making sure the healthcare services are distributed equitably to everyone who needs it. Again, involving community into the development and provision of the healthcare services, making sure health promotion related activities are performed, which means that improving people's diet, improving healthcare condition, living conditions in which people live in, so that their healthcare needs are met and people live a healthy life. Making sure that people understand the importance of various different habits, for example, healthy eating, brushing your teeth, walking, exercise, and so on and so forth. Using appropriate technology to provide appropriate healthcare services wherever it's available and needed, and using a multi-sectoral approach where making sure that health is not just only the responsibility of people who are working in health or any one single profession or any one single personnel, but it is different sectors, be it's education, be it's health, be it's planning, be it's environment, to come together to make sure that all uh, facilities in all sectors work together to ensure the health of the people is preserved and promoted. There have been certain criticism of primary healthcare approaches at the time when the approach was presented in 1978. So, for example, the approach was criticized for having unclear targets as to what would you would like to achieve. People felt that it was too broad and there were too many things to be covered in under the umbrella of primary healthcare, and therefore it was unachievable, and people were concerned about the cost and expenses implications of the services provided. These criticism then led people to think about various other ways through which primary healthcare can be provided and how to tackle the issues which people criticize the approach for. So there are different models of primary healthcare, and you would probably see a comprehensive model, a selective primary healthcare model, and a medical model. And here you can see a comparison of between these three models, that within how health is viewed in each of the models. If you look at the comprehensive model, the health is seen as positive well-being, where people are able to live a healthy life and achieve potentials that they have. Selective primary healthcare model sees the health as absence of disease, where no disease is available in a certain community or for a certain individual, whereas medical model also sees health as absence of disease. Whereas now we understand that health is much more than absence of disease. It's about how you live your life, it's about how you feel about yourself, and if you're able to achieve what you wanted to achieve in life. With regards to locus of control over health, comprehensive model believes that it has to be communities and individuals for whom health is provided. Selective models believe that the locus of control should be with healthcare professionals who should be the custodian to provide healthcare services. And medical model believes that it's only the doctors and medics who have got the custody of the control, and they should have control over it. With regards to major focus, comprehensive primary healthcare believes that health is through equity and community development, that everybody has to have we should be focusing on community development, and therefore that would help improve health of the communities. Where selective primary healthcare model believes that health should be the focus should be on improving health through medical interventions where needed. So you will see examples, for example, there was this example of rehydration, and especially with children who were with diarrheal diseases, and how can you make sure that they are rehydrated enough, they're okay, and family planning services, and other aspects of that. And if we come to the medical model, it feels like disease eradication should be done through medical interventions. With regards to healthcare providers, comprehensive models believes or focuses on multidisciplinary team, where not one single profession is responsible for provision of primary care, but every sector or every healthcare profession who are involved in the system. Selective healthcare models believes doctors plus other healthcare professionals responsible for provision of healthcare, whereas medical model only doctor is responsible, and they believe that everybody else helps them to provide services, but it's them who are responsible. With regards to strategies of health, comprehensive model believes on use of a multi-sectoral collaborative approaches, where selective models believes on using medical interventions to improve situations, and medical model again believes on the medical interventions to improve situations. So you will, if you reflect on the practices or the what kind of primary healthcare services are provided in your community and where you have come from, you will be able to see if that was comprehensive, if that was selective, or are we basing it on medical model. I would encourage you to think of these three models and think of the community where you live and try and think what kind of model of primary healthcare approach is used in that context. Thank you for listening. If you have any questions, please drop me an email. Thank you.